Hi there, and welcome to the labor and birth class. This class is accessible while you're waiting for appointments and also from the comfort of your home. We encourage you to watch this more than once and to include your support people, as they will be the ones supporting you during much of your labor and birth. IWK Health is committed to making sure everyone feels included. We have a diverse community, and that diversity is respected and celebrated. The Health Center will make every effort to meet your needs, and please don't hesitate to let us know what we can do for you. IWK Health is located in Mi'kmaq, the ancestral and unceded territory of the Mi'kmaq people, and we acknowledge them as past, present, and future caretakers of this land. This class is focusing on normal labor and birth. Most births are normal, and so it's important to understand what is happening with your body and your baby. We will cover the changes in your body leading up to labor and during labor. We'll also discuss how these changes might feel and how your support people will see these changes. Lastly, we want to discuss the ways that you can support yourself and be supported throughout the process, and when to seek care. Pregnancy, labor, and birth is a time in a person's life where you must be vulnerable and place a tremendous amount of trust in the people around you. This can be challenging for so many people. Who you are is a result of your life experiences. If you need to stop this presentation or step away at any time, please feel free and safe to do so. Move at your own pace and return when you're ready. This class is not meant to replace the communication that you will have with your health team, but rather encourage conversation and reflection as you move closer to your birthing day. If you watched the Wellness in Pregnancy class, then you would have learned that we're really striving to encourage patients and families to ask questions and probe conversation, and to take the lead in their own healthcare decisions. We really value your feedback, so please take the time to leave comments in the chat and help us improve the class. To start this class, we wanted to take a moment and highlight an important concept. Pregnancy, labor, birth, and raising a child are truly transformational moments in people's lives. There is a reason that pregnancies take 9 months, and children are not ready to walk as soon as they're born. We need time to change our bodies, our ideas, our priorities. This quote, "The moment of surrender is not when life is over, it's when it begins," gives us a starting place to encourage you to think about all of these changes and how you can start to embrace or surrender to each part of the process of your pregnancy, birthing, and on your parenting journey. If you reflect on all the changes that your body has gone through so far and how well you've managed, you can use that as a launch pad for the changes coming. Your baby's movements have likely been plentiful and large, big rolls and kicks. These movements will change near the end, and while they will still be frequent and strong, they may feel different because your baby is getting lower into your pelvis and starting to grow into the limits of their space. Insomnia can creep in at the end of pregnancy as well. This is common, and though undesirable, not something to worry about. You will have the energy for your labor. Trust that your body knows what it's doing. With your baby moving lower into your pelvis, you may have new aches and pains in your groin, lower back, and thighs. Keep moving throughout the day to prevent getting too stiff and stay well hydrated. In first pregnancies, the baby moves deeper into your pelvis between 36 to 38 weeks gestation. In second and subsequent pregnancies, they may move in and out of your pelvis more often. This is because your uterus and pelvis have already held a baby, and therefore the tissues are softer. This movement may also cause your vaginal secretions to change. Unless you feel very wet and you think your water is broken, this is all normal. Think back to the Wellness and Pregnancy video that you've already watched. You may remember that we are strong promoters of self-care and love. Pregnancy is a very special time, and it's not always easy, so be kind to yourself. Taking time for yourself and surrounding yourself with people who love and believe in you is a recipe for good health. We have mentioned the late pregnancy changes. Now we are into the final days before labor, and these changes and early signs are likely to become more prominent. If you haven't already noticed increased pressure, you likely will now. You may have some loose bowel movements or a glob of mucus from your vagina. These are not signs that have to happen, and they don't tell us anything about a timeline of when things will really start. But be reassured, your body and your baby are getting ready. So far, we've covered some very early labor signs that you may or may not experience. And now we're going to get into some of the details of labor, the stages, what is happening in your body, what it feels like, and how to work with it, not against it. It's important to remember here, we are talking about normal labor, labor that starts on its own, progresses, and doesn't last too long. It's hard work, but it's very, very doable. So in order to talk about labor, we need to talk about hormones that are making the whole process happen. These are hormones that help your body progress in labor and ones that help to manage the process. Oxytocin is often called the love hormone. It releases when we feel the most safe, which is why laboring at home for as long as you can be very effective. It works in what's called a feedback loop. Oxytocin is released, and as your labor progresses, more and more of the love hormone gets released. Endorphins are made in our bodies when we exercise, experience pain, or even a massage. They are the body's natural pain relief. And when endorphins start, they are slow and build up. At the height of your labor, you will have the most benefit from endorphins, and they make you feel sleepy. Try to remember when in your labor that when you start to feel tired, it's because your body is helping you to stay relaxed, not because you're too tired to keep going. The other predominant hormone that can appear is the stress hormone, epinephrine or adrenaline. This triggers fight or flight. It's natural to feel nervous about labor and have some fear, especially when this is your first birth. This hormone can slow things down. And as much as possible, prepare yourself by learning how your body works. Trusting the process of labor and surrounding yourself with people who believe in you will help you do this and keep those fear hormones at bay. So let's talk about labor. The first stage of labor has two parts, and they are both equally important at getting you closer to your baby. Diagram A and B is pointing to what your cervix looks like before your labor begins. You can see that it's long and closed. It's likely shortening and softening at the end of your pregnancy, but the bulk of the work is being done during the late or early phase of your labor. Diagram C is showing the cervix now thin, and diagram D is showing that it's starting to open and the bag of water surrounding the baby is starting to bulge through. Now that you can visualize what's happening to your cervix, let's talk about what this will look like and feel like. The cramping usually starts out quite mild and achy, low and in your abdomen. Sometimes people will feel a little bit of discomfort in their back. If you experienced menstrual pain or period pain in the past, this is what it often feels like at the beginning. But rather than coming and staying for several hours, it comes and goes in waves. There's not necessarily a pattern, and the cramping may only last a short time in the beginning. We can't stress enough the importance of this stage. It's so exciting when labor begins, and when it's your first labor, it's natural to want to pay attention to every single cramp and even go to the hospital, maybe before you should be. For your labor to build and your oxytocin to be most effective, resting and being quiet is so important. This stage can last a few hours or a couple of days. Your oxytocin will release more and more when you feel safe and relaxed. This early stage of labor is not the time to be too active. Once labor is established, movement and position changes are really important, and we'll cover that a little later in the presentation. This stage, rest, eat, and drink normally. You will need to be hydrated and fueled for the next stage. Rest as much as you can. Your relaxed body will more easily allow your labor to progress. The early phase of labor will eventually shift into the active phase. You will notice a consistency to the pattern of your contractions. They will start and peak and then recede. In between the contractions, you will not feel any cramping. This pattern allows the process of labor to happen without people needing pain relief if that's their choice. When you're in this stage, progress is happening. Your cervix is opening and your baby is moving deeper into your pelvis. This is another great diagram for showing the cervix thinning and effacing as you move through this stage of your labor. This is where your labor is intense. The contractions have been building in strength, getting closer together, and lasting a little longer. You're now feeling the cramping low and deep. They'll be starting every 3 to 5 minutes, and they'll last 60 to 90 seconds. Like in early labor, in between the contractions, there is no pain. You will also have a surge of endorphins, which is your body's natural pain relief. You may feel sleepy and dopey in between contractions. Your provider may have mentioned 411 to you. This is a contraction every 4 minutes, lasting a minute for an hour. That's 3 minutes break in between. Let's talk about how to work with this stage. Active labor is intense and it will challenge you. The contractions are strong. Changing positions will help you and help the baby make progress. Make sure your support people are working with you and they're prepared along with you. This will be hard for them to watch, so they need to know that labor is hard work and normal. Breathe. Breathe in and breathe out. Stay with your breath through the whole contraction and let the break in between be your rest. There are many ways to promote comfort during labor and birth. If you're progressing normally throughout your labor, you may choose to only use a few non-drug comfort measures to support you through the process. If you do choose to have pain medication in your labor, you can also still use many of the available comfort measures before or after receiving pain medications, and even some while receiving pain medications. A few of the very effective tools to promote your comfort are deep water immersion, massage, acupressure, use of transcutaneous nerve stimulation or TENS machine, and creating a comforting and peaceful environment. Position changes are so important for the progress of labor and for managing the intensity of contractions. It is normal to find a position and stick with it when things are working for you. You will be hesitant to change. It's helpful to change up your position every 30 to 45 minutes. So think about suggesting positions and also let your support team know to encourage you to make these changes. As you're working through your labor, there is a consistency happening. The contraction comes, it peaks, and it recedes. They come every 2 to 4 minutes, and they last for around a minute. When transition starts, you know you are getting to the end of the first stage. This is reassuring progress, but it can be challenging to cope with. The last part of the cervix is dilating, and the head is coming through the cervix. On exam, when your care provider can no longer feel any cervix, this is called fully dilated, or 10 centimeters. The contractions will change, and instead of feeling them only deep and low, you will start to feel them through your pelvis, and at the peak of the contraction, you will likely start to feel some rectal pressure and make sounds like that. That reliable contraction pattern you have come to depend on will now be gone. It's often a time when people start to feel scared or feel like they can't do it, but guess what? You can, and you already have. Transition usually only lasts 30 to 60 minutes. This is a time to ramp up your support. Your care providers will recognize this and suggest changes in you, a new position, perhaps the tub, and help you focus on your breath. Your support people should know that this stage might look a little wild, but it's important to remember that you're nearing the end. Being fully dilated doesn't mean it's time to start pushing right away. When labor is progressing normally, you will feel the urge to push come gradually and then intensify to the point where you have to push, breathing through the pressures until this happens. Pushing is often a time when people feel better. The first stage of labor is hard because you don't know how long it will be. But then with the second stage, you know the end is near. This stage usually lasts 2 to 3 hours, and sometimes shorter. The pushes happen with the contractions. In between the contractions, the pain from the contraction in the first stage is now totally gone, and all you feel is pressure in your pelvis, rectum, and vagina. You want to push into the pressure. The force of the baby working to move down, your uterus contracting, and you pushing all works together. Pushes are long and strong, and you will have support to guide your pushing and breathing if you need it. Listen to your body. Push when it feels right and trust in the process. As your baby moves through your pelvis and starts to stretch the tissues around your vagina, this will feel intense. Although this burning sensation is intense, it doesn't last very long, and it means the end is very near. Once your baby's head is born, you will feel relief. The next contraction is your baby's body, and then your baby is in your arms. Things like warm compresses can really help to alleviate this pressure and intense feeling. Changing positions in the second stage is important to help you make progress. Different positions will also allow you to stay loose and get a feel for what position is working for you. These are some examples of different positions. Your care providers will likely suggest many of these. Your baby has been born. There is so much excitement and energy in the room. Sometimes it's loud and exciting, and sometimes it's quiet. This is your birth, and it's unwritten. One thing you can think about is how long you want to delay the cutting of your baby's cord. There is evidence that delaying cord cutting is beneficial to your baby. As well, it's not necessary to rush. Because of everything we know now, this is often not rushed by your providers. But we encourage you to take the opportunity to discuss your wishes about cord cutting with your care provider and make a plan. There are times when the cord should be cut sooner, such as if your baby needs a little bit of extra support, but often there is time to delay. Once your baby is out, there is still work to be done. The placenta is the organ that connected you and your baby. The importance of it to the pregnancy is huge, but its job is now done. Your body will detach it naturally and work to push it out. Just like how the oxytocin helped your body contract to have the baby, the same is true for the placenta. You may choose to have an injection to speed up this process. The injection is a synthetic version of your body's own oxytocin. It doesn't go through to the baby, and it doesn't have harmful side effects. It is still your choice whether to have it or not, so chat with your provider about this option. Having your baby skin to skin will help your body to continue to release oxytocin, which will also help in the process. Your body was able to push your baby out, so very likely it will be able to push your placenta out. The golden hour is this amazing time that you only get once with your baby. This special first hour or two is time to bond, let the oxytocin flow through your body to help that bond, as well as to help your uterus contract, which makes your placenta separate and control your bleeding. It's a very special time, family and support people. The pathway to trusting your instincts will be your own journey. Surround yourself with people who believe in you and talk to them about your fears. Focus as much as you can on positive thoughts around the birth and listen to their stories. While birth can never really be planned, it is helpful to have some ideas written down. Think about what values you're bringing to the process, and be sure to have that open communication with everyone around you. We've covered a lot of information about labor and birth and the first moments after. You have a lot to think about, to decide on. It's important to remember that planning a birth is tricky, as we all know that it's unknown. But what you can plan are things like who you want with you, what pain relief you might consider if you needed it, and what interventions, if they're recommended or necessary, would you be okay with? Make sure you discuss this with your care providers as you're writing it, and they should be able to help you with any concerns that you might have. Bring a copy of your intentions with you when you go into labor. We hope this presentation has been helpful. We hope that you now know more about labor and birth than when you started. And hopefully with this knowledge will come the belief that your body knows what to do. Trusting your body and this process takes time, so don't hesitate to watch this class again. Share it with your support people so they all understand as well. Talk to your support people. Let them know what your intentions are, your fears. Let them know how they need to support you. We are a small group of providers who are passionate about informed decision-making and patient education. Please don't hesitate to provide feedback about this class and other classes that you've accessed. We want to provide the best information to meet your needs. Thank you.